The next paper is on periocular Topotecan for vitreous seeds in retinoblastoma. The presenting author is Dr. Purnima Rajkarnikar. Dr. Purnima is there. Yeah.
Good morning, everyone. I'll be presenting on periocular Topotecan for vitreous seeds in retinoblastoma. We have come a long way in the management of retinoblastoma with an aim of saving life to an aim of saving vision with more targeted therapies like intraarterial chemotherapies, TTTs, and cryotherapy. In spite of this, vitreous seeding is a big challenge in management of RB because of the avascular vitreous chamber, which hinders the penetration of intravenously given chemotherapies, so that the tumor gets regressed with targeted therapies, but vitreous seeds persist. Therefore, intravitreous route of chemo is widely used, but there is always a possibility of extraocular extension of the large viable tumor through the needle tract. Therefore, in these times, during the active phase of disease, periocular chemo is the best alternative. Intravitreous concentration of drug by periocular mode was found to be 6 to 10 times higher than that achieved by intravenous route alone. Carboplatin is effective and has been used by many surgeons, but it has serious local adverse effects like orbital fibrosis and optic nerve atrophy. Recently, Topotecan has been widely used in retinoblastoma. For intravenous Topotecan has been proved to be effective in extraocular and relapsed resistant intraocular tumors of retinoblastoma. Intravitreal Topotecan has already been proven to be effective in treating vitreous seeds, but to our knowledge, this is the first study of its kind specifically done on its response in vitreous seeds alone. Therefore, the purpose of this study is to study the treatment response of retinoblastoma with vitreous seeds to periocular Topotecan. It is a 4-year retrospective interventional study done at National Retinoblastoma Center for Site, Hyderabad. 38 consecutive eyes of 35 RB patients with viable vitreous seeds during the course of systemic chemotherapy were taken. A variable number of injection Topotecan 2 milligram in 2 ml in the posterior subtenon space in the quadrant closest to the location of the vitreous seeds were given. And the result were, the mean patient age was 24 months. In international classification of retinoblastoma grouping, the maximum number of patients fell into group D, that is 21, followed by 10 in group E, 3 in group C, and 2 in group B. Focal vitreous seeds in 20 eyes needed an average of 3 periocular Topotecan injection, most of them receiving 2, and diffuse vitreous seeds in 19 eyes required an average of 4.2 injections of periocular Topotecan, and most of them healed with 5 injections. This is an example of the multiple tumors with focal vitreous seeds. You can see in the right-hand side, with the periocular Topotecan and systemic therapy, both the tumor is healing, whereas seeds have completely disappeared. This is another group C tumor with focal vitreous seeds around the tumor. With systemic therapy and periocular injection, the seeds have completely disappeared and the tumor is regressing. This is example of group D tumor with the diffuse vitreous seeds coming out from the tumor. Along with both of these treatments, the tumor has regressed into a calcified and flat scar, whereas seeds are regressing with periocular Topotecan. This is another example with the large vitreous cloud overlying the tumor. And in the left-hand side, you can see the regressing vitreous cloud and tumor with periocular Topotecan, along with the systemic chemotherapy getting regressed. The therapeutic success in terms of continued regression of vitreous seeds with this method alone was seen in 56% of the eyes, that is 20%. However, persistent cells were seen in 8 cases, that is 22%, which needed an additional intravitreal Topotecan after completion of systemic therapy. And EBRT was needed in 1 case. Eye salvage rate in eyes with focal vitreous seeds was 95%, which is very promising, and diffuse vitreous seeds was 68%. This is again a group D tumor with vitreous seeds. After systemic chemo and periocular topotecan, the tumor has regressed beautifully, whereas there is a persistent vitreous cloud. Now this eye is safe for giving intravitreal topotecan. Again, it is again a large tumor with diffuse vitreous cloud. Tumor regressed and the vitreous seeds regressing. And with the additional of intravitreal topotecan after completion of systemic chemo, both the tumor as well as the vitreous seeds have calcified and regressed. Enucleation was, however, in spite of all this, enucleation was done for 7 patients for persistent vitreous seeds and viable tumor in 5, and for large viable tumor alone in 1, and recurrent vitreous seeds in 1. However, no histopathological high-risk factors was documented in any of them, and none of our patients had extraocular tumor extension or systemic metastasis. There was an occasional side effect of conjunctival chemosis with the topotecan. So this is again a group D tumor with diffuse vitreous spheres. Both vitreous seeds and tumor have calcified over here. Therefore, I would like to conclude by saying that periocular topotecan injection provides a safe and lasting vitreous seeding control for cases who are undergoing treatment for active retinoblastoma. It can be followed by intravitreal injection in persistent seeds. Thank you.
So what was the maximum follow-up in your patients?
The maximum follow-up was that we follow up the cases until the seeds and the tumor is completely gone, and after that every 3 months for 1 year.
Your group D eyes, which had maximum vitreous seeds, 21 eyes.
Yes, ma'am.
7 of them got enucleated.
Yes.
So what was the maximum follow-up in these patients, or your total patients? How much was the maximum follow-up?
This is an ongoing study. This is ongoing. These patients are still coming for EUAs, and we have not stopped following them. So this is
what was the average follow-up of your study?
The average follow-up was 6 months, ma'am.
Okay. How would you rate this? 7 eyes were enucleated.
Yes, ma'am.
Because of persistent
vitreous
seeds
and
because of recurrence. So, and in 1 you had to give intravitreal topotecan also.
Yes.
So how would you grade your response to periocular topotecan?
Periocular topotecan mainly we give during the systemic chemotherapy, but intravitreal, if required, if there is a persistent seeds, then only we give after the systemic chemo.
So you have only 6 months follow-up, but in your conclusion you say that it gives a lasting response.
Yes, ma'am.
Which is not correct.
This is an ongoing study, that's why.